Let's take a look at the answer. The difference between an autoantibody and a normal antibody is what they flag for the immune system to attack. And the difference between a self-antigen and a foreign antigen is where they are found. So autoantibodies will flag your self-antigens found on your own body's tissues and organs, and normal antibodies will flag the foreign antigens found on foreign invaders like viruses for your immune system to attack.
There is no definitive cure for lupus, but there are many different types of medications that can help reduce your lupus symptoms. Your doctor may recommend any combination of medications to manage your symptoms and offset potential side effects. We're going to take a closer look at 5 of them. First, we're going to talk about antimalarials like hydroxychloroquine, also known as Plaquenil. You may be wondering how antimalarials can be used to treat lupus. Well, generally, antimalarials work to reduce autoantibodies, which is a key feature of lupus. By reducing this, it reduces pain, inflammation, flare-ups, and skin rashes. However, there are some side effects to consider. The most prominent side effects are eye problems, causing retinal damage. Other problems can include stomach pains and digestive issues, like nausea and vomiting. Next, we're going to talk about steroids. Steroids can decrease the activity of overactive immune cells like B and T cells. This reduces inflammation and the severity of symptoms. You may have heard of steroids in the context of athletes trying to improve their performance. These steroids are referred to as anabolic steroids, and they are different from the steroids used to treat lupus, which are corticosteroids and glucocorticoids. The most common steroid used to treat lupus is prednisone. Now, there are a few ways that steroids can be taken. It can be taken through pills, through injections, or through a skin cream or gel used for the skin rashes. Unfortunately, steroids come with a variety of different side effects, which include swelling, weight gain, and sleeping problems. Long-term use of steroids can also lead to an increased risk of more severe health problems like infections, osteoporosis, meaning weak or brittle bones, and diabetes. Next on the list are NSAIDs, otherwise known as non-steroidal anti-inflammatories. These are the most common type of medication used to treat lupus. You may have already used NSAIDs in your day-to-day life with ibuprofen and naproxen. Similar to steroids, these medications reduce inflammation and pain by reducing the chemicals in the body that cause the inflammation. NSAIDs are used for many other conditions. Beyond the over-the-counter NSAIDs like ibuprofen, there are also prescribed NSAIDs like celecoxib and indomethacin. Acetaminophen, also known as Tylenol, is not an NSAID. While it can help ease pain and lower fevers, it does not treat inflammation or lupus symptoms. Although NSAIDs are commonly used, there are some side effects. Stomach pain and ulcers are particularly common with this medication. To avoid or mediate these side effects, there are some steps that you can take. First, you can take NSAIDs with food to help prevent stomach pains. Second, you can take the medication prescribed by your doctor to help with digestion issues like proton pump inhibitors and over-the-counter antacids like Tums, which will help with the protection against ulcers. Next, we're going to talk about immunosuppressants. As their name suggests, these medications work as suppressors of the immune system, and each immunosuppressant works slightly differently and treats different lupus symptoms. One common example is methotrexate, but there are others. The downside of these types of medications is that they can make it harder for your body to fight off infections. Steps should be taken to protect yourself from infections if you are taking an immunosuppressant. Things like washing your hands often, or cleaning and protecting your wounds and cuts, staying up to date with your vaccines, and avoiding people who might be ill or have a cold or transmissible virus. In addition, there are some side effects for each individual drug that could occur with their use. For example, they could potentially damage some of your organs, like your liver, or they could raise your risk of cancer. Finally, we're moving on to monoclonal antibodies, otherwise known as mAbs. This is one of the newer therapeutic approaches for treating lupus and falls under the category of biologics. Biologics include any medication that comes from a biological source. In the case of mAbs, they are made in and collected from living cells and then processed into medication. But really, how do these mAbs work? mAbs are designed to target the specific parts of your immune system that are overactive and lead to the inflammation associated with lupus. So, they reduce your lupus symptoms by reducing this inflammation. There are two types of mAbs that have been approved for lupus treatment. One of them is called belimumab, also known as Benlysta, and another is called anifrolumab, also known as Cefnello. These two mAbs can be administered using either an infusion or an injection. However, these medications do come with their own side effects. This can include nausea and diarrhea, fever, trouble sleeping, arm and leg pain, migraine, headaches, and increased risk of infections, including shingles. All in all, there are a lot of medications that can be used to help treat the symptoms of lupus. You and your doctor can work together to determine the best therapeutic approach for you.